Skyrocketing COVID-19 cases in India have propelled that country into a humanitarian crisis. Yesterday, India set a global record of more than 350,000 positive cases in a single day. Hospitals continue to struggle with low supplies of medicine, oxygen, and hospital beds. And joining us tonight is Dr. Veena Sriram. She's an assistant professor at UBC in the School of Population and Public Health. And she's also part of a global India COVID SOS network addressing the crisis in India. Dr. Sriram, thanks for joining us tonight. Can I ask you, first of all, to take us through what led to the COVID crisis that's escalating in India? It's a horrific situation there.
Absolutely. Thank you so much for having me. The health system was sort of different for depending on how much you earned, what your income level was, what part of society you were in. It was really two health systems for two classes. And I think what's happened during COVID right now is that it's become a universal reality where everyone is struggling and the system is under tremendous strain. What led to this problem, though, is a sense of complacency that set in between the last wave last year and what's happening now. The time that we had in between these two waves could have been spent in further preparedness and making sure that we had oxygen supplies and making sure that the right protocols were put in place. And unfortunately, that was not done. I think a final reason is around sequencing of variants. India was not necessarily sequencing all the cases that it had, so we don't quite know what is causing this current spread in terms of the makeup of the virus. But many suspect that it is due to a mix of variants right now, and we have more work to do to figure what those are.
And India's health system is under tremendous strain right now. What are the biggest challenges facing doctors, healthcare workers in India right now?
There is an immense shortage of beds. So if people wanted to come to the hospital to seek care, there's just nowhere for them to go. When they do come to the hospital, some hospitals are struggling with the shortage of oxygen. So there was a situation in Delhi a few days ago where about over 20 patients died because the truck carrying oxygen that was coming to the hospital was delayed by a few hours. There are so many stories like this happening in many parts of the country. The other thing people are facing is that because there are no beds, people now have to take care of their patients at home. And that means that doctors are constantly on the phone with their patients. Family members are having to care for people who are sick with very little medical training. So you're seeing a lot of frantic calls on Twitter and WhatsApp and Facebook asking for help regarding how can we help our family member in need.
Yeah, okay. So what can Canada and other countries do to try to help out?
So we're seeing a growing number of countries start to step in. For example, the United States, the Biden administration today announced they're releasing more vaccines to India. Canada has also made some steps towards announcing a plan to help to support India. What we need to do right now is to ramp these efforts up, and we have to do it now because the situation is dire. It is going to get worse if we don't solve it. I think what we truly need, though, is a reimagining of how we as a globe respond to pandemics. The pandemic in Canada is not over unless it's over everywhere. And maybe we can start with, for example, reimagining the vaccine issue and ensuring that there are waivers for IP when we have this kind of crisis.
All right, we will leave it at that. Dr. Sriram, thank you very much for your time tonight. We appreciate it.
Thank you for having me.